Hello everybody. I want to thank you for coming to my presentation of improving antibiotic use and antibiotic stewardship this afternoon. So we'll just go right on and get started. I wanted to mention some objectives that I have with this presentation. I hope that you will be able to verbalize the difference between bacterial and viral infections by the end of this presentation, and that you'll also be able to verbalize one adverse reaction that can occur due to antibacterial effects of drugs. Also, that you'll be able to verbalize the definition of antibiotic resistance. I'd like for you to know how to verbalize threats, at least one threat posed by antibiotic resistance, and understand the difference between colonization and infection and be able to verbalize that. Also, I'd like for you to be able to verbalize at least one practice that you can do to participate in antibiotic stewardship. So hopefully by the end of this presentation you'll know those things. So what's the difference between viruses and bacteria? Well, first of all, bacteria are single-celled organisms. They're found inside and outside our bodies. They can live inside and outside. They can be on a doorknob, a table, or inside of you. Some are bad. They cause illnesses and disease, but others are good, and as long as they stay in the area of your body that they're intended to be in. For example, E. coli in the intestines. It helps to produce vitamin K12 and prevent disease-causing pathogenic bacteria from taking up residence in your gut, and causing you to get sick. So we've got some examples of bacteria here. That's what E. coli looks like under a microscope, and that's what Staphylococcus looks like under a microscope. That's another well-known bacteria. Then we have viruses. They're microorganisms. They're a lot smaller than bacteria, and they cannot survive outside the human body or a body. They require a living host. They invade healthy cells. They cause illnesses by getting in the cell, taking over, and making the cell reproduce their viral DNA. And measles is a common virus that we've all heard of. West Nile virus that people get through mosquito bite exposure is another virus. And that's what they look like under a microscope. So what are antibiotics? They're drugs that are designed to fight infection that's caused by bacteria. They work by two mechanisms of action. They kill the bacteria, and they also create an environment that make it hard for the bacteria to grow and multiply. The important thing to remember, antibiotics do not have any effect on viruses. That is colds or flu. Many sinus infections and ear infections are caused by viruses. Most coughs and often bronchitis are caused by viruses, and many sore throats. So taking antibiotics for these things that are caused by viruses will not do any good. So when good drugs go bad, all medications have potential side effects. Even Tylenol can have a side effect. So there are adverse reactions to antibiotics that just happen regardless sometimes. One is neurotoxicity. That is where negative effects are produced on the peripheral or central nervous system. It can result in such things as encephalopathy. That's where the function of the brain is impaired, and even the structure can be altered when you look at it under an MRI scan. Psychosis, that's hallucinations and delusions, being a lot of confusion, or seizures. Also, we have ototoxicity. As you can see, he's trying to hear what you're saying. That is high frequency hearing loss and tinnitus in both ears. It can be temporary or it can be irreversible. The onset is unpredictable. It can happen soon after initiation of antibiotic therapy, or it may not occur until a month or two after your antibiotic treatment regimen is completed. Another thing is nephrotoxicity. That's where your kidneys are basically poisoned and it impairs function. Certain kinds of antibiotics can cause the small vessels in the kidneys to constrict, and it restricts blood flow to the kidneys, and it can actually cause acute kidney injury. That's usually related to high dose antibiotic therapy or lengthy antibiotic therapy. Whenever people are taking antibiotics, this is one of the reasons why, like in the hospital, a lot of times they check therapeutic drug levels to measure whether they could be getting to a dangerous level to cause any of these toxic effects. So, and the antibacterial effects of antibiotics, good or bad. So we talked about that they kill bacteria or make it hard for them to grow and multiply. But do they know the difference between the good the good bacteria that we talked about, like the bacteria in your gut that has a purpose for being there, or, is all bacteria the same to antibiotics? Well, the truth is they don't know the difference. And so antibiotics can randomly change the bacterial population of your body, and that means even the good bacteria. So that's kind of what happens in that picture. It's kind of like you can't tell who the good guys and the bad guys are. So what happens is what's called a disruption of the microbiome. That's the body's population of good bacteria. And what happens a lot of times is diarrhea. That's a common side effect of taking antibiotics. And what people often end up with is something called Clostridium difficile, or C. diff, as you might have heard it called. You end up with multiple episodes of liquid, very strong, foul-smelling diarrhea. Usually have severe cramping, sometimes fever, nausea, loss of appetite, weight loss. People get dehydrated. They end up needing IV antibiotics. They have a rapid heartbeat because of being dehydrated. And the more serious infectious incidents, you may end up having blood in your stool even. It can lead to something called C. diff colitis, which is an inflammation of the colon. It's very painful. You can also have sepsis. That's where you have chemicals that are released in the bloodstream to fight infection, but they end up kind of running rampant and just kind of go throughout the whole body and end up causing organ failure and sometimes even death. And all of this is related to the use of high-risk antibiotics during hospitalization. Often, studies show that often there's a 30 to 50% misuse or overuse of high-risk antibiotics in hospitals. So, as a result, people getting a lot of these high-risk antibiotics end up being in the hospital again within 90 days of discharge with sepsis. Particularly people who had C. diff during a hospitalization on antibiotics end up, they're a higher risk even of having to come back within 90 days with sepsis. So antibiotic resistance, what is it? That is where the bacteria changes in such a way that it can make the drugs that were designed to kill that infection basically not ineffective. What happens is then the bacteria thrive and multiply in spite of the treatment, and that usually results from overuse or misuse of antibiotics. And this is an example of how antibiotic resistance spreads. a lot of animals get antibiotics. We've started hearing over the years how, some growers are not using antibiotics anymore in their poultry, in the chickens that they raise. But that became an issue with growers of livestock using antibiotics to enhance the growth of their livestock. And then it's there, that resistant bacteria is then left on the meat that is consumed by people. Also, the waste from those animals, it's often used as fertilizer for crops, so that those drug-resistant bacteria from the animals being fed antibiotics, then it gets to the crops that people consume. It also can get to the groundwater from the feces of these animals, and also make its way to crops. That way, whether you're eating meat or produce, you can be consuming antibiotic resistance, basically because there's bacteria present that is already resistant to antibiotics because of the animals being exposed to the antibiotic therapy. In addition, a person can get antibiotics and they begin to develop this resistant bacteria in their gut. Then they can spread it in the general community, person to person, or they can go to a hospital or a nursing home, and that drug-resistant bacteria can be spread in the healthcare setting through healthcare workers to other patients, and it basically just continues this vicious cycle of this drug-resistant bacteria being spread throughout society, basically. The thing to remember is simply using antibiotics creates resistance, and that's why it's so important to remember that these drugs should only be used when indicated against bacteria. And this is just another example of how antibiotic resistance happens. You've got lots of germs, and then there's a few of them that are resistant. The antibiotics kill the bacteria that cause the illness, but they also kill the good bacteria that would prevent illness and infection. The drug-resistant bacteria are then allowed to grow and take over because the good bacteria is not there to stop them anymore. Some bacteria give their drug resistance to other bacteria, transmitting that, and so it ends up spreading. So, how overuse and misuse of antibiotics happens? These are some examples. Taking antibiotics to treat colds and flu. We've already said it's not going to have any effect on viruses or viral-caused illnesses. Also, not completing your antibiotic regimen. Sometimes people stop taking their antibiotics when they feel better. When that happens, not all of the bacteria has been killed. There's a reason why your doctor tells you to take the medication for 7 days, 10 days, 14 days, even if you feel better, because that is to make sure that all of the bacteria have been killed. When you don't finish, what happens is a lot of the bacteria have been killed, but some of the bacteria haven't. But now they've been exposed to that antibiotic, and they're allowed to continue living. They know that antibiotic now. They recognize it if you ever try to take it again. And they know how to avoid, if you want to call it that, the effect of that antibiotic. A lot of times people, when they stop taking their antibiotics when they feel better, they save pills for the next time when they're sick. Well, what happens then is, every infection is not susceptible to every antibiotic out there. There are antibiotics that are effective against this bacteria but not effective against that bacteria. And you don't know when you get sick which bacteria you have. This is why we do blood tests and cultures. That way we can determine specifically what organism you have and to know what organism is going to be effective. Some bacteria are killed, others remain, and they develop resistance. So bacteria resistance. Some bacteria counteract antibiotics and they make them harmless. That's because they know them. They've been exposed to them before and they know how to counteract them. Some bacteria learn how to pump the antibiotics back out of the cell before the antibiotic can have a chance to kill the organism. Some bacteria learn how to change their little outer membrane to prevent the bacteria from being able to attach itself to the organism and kill it. Sometimes one bacteria survives antibiotic exposure just because it just found some way to resist it, and it multiplies and it replaces the bacteria that was killed, and it creates, that antibiotic exposure creates a sort of selective pressure so that the surviving bacteria is more likely to be resistant. They also become resistant through mutation of their genetic material. Again, that's where they learn the effect of that antibiotic and use it to change their DNA makeup so that they can counteract the effect. So what are some major threats posed by antibiotic resistance? Well, like we've already said, loss of effective antibiotic therapy. We run out of drugs that are effective against these organisms, and that has happened. We've had to try to push in recent years to come up with newer synthetic antibiotics that will be effective against a lot of these organisms. And it's really endangered people who are undergoing surgery or possibly chemotherapy. They're usually given a preventative antibiotic before surgery or before undergoing chemotherapy that kind of gives their body a little boost to help protect them when their immune system is impaired. And if they already have bacteria in them that is already knows about that antibiotic, is already resistant against it, then they continue to be susceptible to infection when their immune system is, weakest. Resistance, as we said, it can be passed from one bacterium to another. It can be passed from person to person. There are examples of methicillin-resistant Staph aureus, MRSA. That's one of the biggest problems. Vancomycin-resistant Enterococcus, VRE. Carbapenem-resistant Enterobacteriaceae, and Clostridium difficile, or C. diff, which we've already talked about. And as I said, antibiotic resistance is one of the most serious threats to health in the United States. And these are some data from the Centers for Disease Control about antibiotic resistance. More than 2 million people annually contract serious bacterial infections that are resistant to the antibiotics that are designed to fight them and treat them. At least 23,000 people die annually from antibiotic-resistant infections. Almost 250,000 people require hospitalization for C. diff infections. In most cases, antibiotics were used in a prior hospitalization and were a contributing factor to developing C. diff. And at least 14,000 people die annually from preventable C. diff infections. Then we have methicillin-resistant Staph aureus, MRSA. Like I said, it's a leading cause of healthcare-associated infections. There's been as many as 80,461,000 severe MRSA infections reported annually, and at least 11,286 deaths reported annually. So it's really serious, and it does contribute to the cost of health care under a system that's already kind of breaking under the expense. There's like $20 billion in excess healthcare costs related to the treatment of antibiotic-resistant infections. And C. diff infections alone result in $1 billion in excess healthcare spending annually. So we mentioned earlier infection versus colonization. So I want to explain the difference here. With infection, you have the existence of organisms in your tissue that are causing destruction. As we can see here, the lady's got redness. Looks like from her expression it's painful. So that's what you get with acute inflammation resulting from infection is, the pain, the swelling, redness. Usually the area is going to be warm or hot to touch. You may have fever and you may have loss of function of that limb because of it. Now, colonization is where you have bacteria growing on a body's surface that's not causing any illness. It may be a normal process. It could be part of your body's normal flora, or it may not be part of the body's normal flora, but just not causing an illness. And treatment with antibiotics isn't necessary with colonization, whereas it is with infection. So some examples of colonization, Staph aureus. It can be on your skin for some people, not causing any problem. It's normal flora, really, for the skin. A lot of people actually have it on their skin, but where the problem comes in is where you have a break in the skin, a wound, and staph gets into that it gets into that wound, and it can cause a serious infection. Also, Neisseria meningitis. It can be found into up to 30% of the healthy public in their oropharynx, which is the area like right in the back of your throat and nose back here, and I'll show you on the next slide. And you have no problems from it. But if it manages to make its way into the bloodstream, then you would have a serious infection requiring emergent treatment. And that's the oropharynx area that I was telling you about. You have the nose and the mouth, and it's right here at the back of the throat. Like I said, the Neisseria meningitis can live there without causing any illness or harm. So what does all this mean? Now, let's define antibiotic stewardship. That is the coordinated interventions designed to improve and measure the appropriate use of antibiotic agents by promoting the selection of the optimal antibiotic drug regimen, including dosing, duration of therapy, and route of administration. And that's from nursingworld.org. So number one is the responsibility of the healthcare team. And that is that we want to choose the right medication, and that's where doing blood cultures and cultures of wounds come in, so we can identify what kind of infection it is so that we can select the most appropriate antibiotic. And ideally, you want to pick the least powerful that will be effective against that organism. You want to give it at the right time, the optimal time, hopefully not long after the onset of the symptoms. And for the appropriate duration, usually, a lot of times when you're prescribed antibiotics at home, you may be told to take it for 7 to 10 days, 14 usually max. In an institution, in the hospital, or some rehab setting, you usually are not going to take that antibiotic for more than about 21 days. But now patients also play a role in antibiotic stewardship, and we're going to discuss how that is. Ways you can practice antibiotic stewardship is to talk to your healthcare provider about it. And, ask them ways that maybe you can manage your symptoms and get symptom relief without having to take antibiotics. Sometimes going back to some of the old home remedies that our grandparents used is actually helpful. When you are prescribed antibiotics, take them exactly as your healthcare professional advises. If you have any leftover medication, throw it away. Don't keep it to take for a later date, for another illness. Also, talk to your healthcare professional about ways, things that you can take, vaccines that are available to prevent infections that would end up requiring antibiotics. Certain people that fall into certain risk groups and age groups need to take a pneumonia vaccine, possibly. There's also the flu vaccine. While, as I said, the flu is a viral illness, sometimes when you get the flu, you end up with an opportunistic secondary infection that ends up requiring an antibiotic. Taking your flu shot and avoiding getting the flu would avoid that situation. Do not skip any doses of medication. If you forget a dose, take it as soon as you remember. Don't take antibiotics for viral infections. Don't pressure your doctor or nurse practitioner to give you an antibiotic when you don't really need one. Also, don't, as we said, save antibiotics for the next time you get sick, and don't take antibiotics prescribed for another person. You're really not supposed to take any medication prescribed for another person. Okay, any questions?
What are some of the examples of antibiotics?
Good question. Well, some of the antibiotics that you might be prescribed to take at home for an illness are amoxicillin, ampicillin. Sometimes people get what's called the Z-Pak, zithromycin. But those are examples of some of the common, home prescribed medications. In the hospital, a lot of times IV antibiotics that are given are vancomycin, zosyn, gentamicin, again depending on the infection and the severity of it. A good question. Any other questions?
Since we don't take antibiotics for viruses like the cold or the flu, what should we do to treat those conditions?
Great question. If you have a cold, most of the time, getting plenty of liquids, rest, taking some vitamin C are the number one things that you want to do. And if you have any, pain or discomfort or anything like that, Tylenol is good. Also, you can take a decongestant to treat some of your symptoms. If you're having a cough, a lot of times cough medications with like guaifenesin in them are good, Robitussin. If you have a lot of chest congestion, things like Mucinex, again, along with plenty of fluids, helps get a lot of that out. If you have to, then you can always go to the doctor, and sometimes they can prescribe a little bit stronger versions of the guaifenesin. But things like that to help treat the symptoms. Most of the time, you just really have to take care of yourself and let it kind of run its course. If you get the flu, usually as soon as you realize it, try to get to the doctor. They can give you Tamiflu, and that helps a lot with the symptoms. You don't have it nearly as bad, and you seem to get over it a lot faster. But basically just taking care of yourself, getting plenty of fluids, rest, vitamin C. Any other questions? Great. Well, thank y'all very much for being here, and I hope you got something out of the presentation. Thank you.